Hello everyone. Welcome to Lify Life. Does your child need a speech therapist consultation? What should alert? At 5-6 years old, the child's speech should be correct in articulation, clear and understandable to others. If you notice that your child stutters, lisps, or has difficulty making certain sounds, it is worth contacting a speech therapist. When to go to a speech therapist with a child? If such a question arose in your head, then you should contact the specialist as soon as possible. After all, it is better to know that everything is in order than to downplay problems, and then regret that you did not take advantage of professional help. The family medicine doctor claims that the earlier work on the problem is started, the lower the risk of consequences, which will then be difficult to correct. What does proper speech development look like in a child? At 5-6 years old, the child's speech should be correct in terms of articulation, that is, the pronunciation of individual sounds, clear and understandable to others. Now the child should use grammatical forms correctly and have a vocabulary that allows you to describe pictures, tell stories and answer questions logically. Parents should pay attention to the development of the child from the very first months of his life. So, already in the period of 4-6 months of life, special attention should be paid to whether the child hears, that is whether he turns his head to the source of the sound, whether he reacts to a change in the timbre of his voice, to music from toys. If during this period there are no such relevant reactions, it is worth contacting an ENT doctor and having the child have a hearing test. It is also worth consulting with a speech therapist who will tell you how to deal with such a small child. Before 12 months of age, there are additional responses to environmental speech, such as "Where's mom?" or "Where's the car?" The child can point to them. Also, in addition to babbling, he uses sounds, gestures, facial expressions and even symbol words, mom, dad, woman, buy, on, give, to attract attention. Until the age of 2, a child who develops correctly can show parts of the body, nose, eye, hand, etc. He can follow simple commands like wave bye-bye, bring a toy, give a hand. At this age, the child knows how a dog and a cat speaks, can repeat woof woof or meow meow. By the age of 3, the child should acquire additional speech skills. At this age, he can distinguish between opposites, warm cold, big small, day night. The baby fulfills more and more complex requests, for example, put the doll in the stroller and cover her with a blanket. Names most objects in the environment, knows his name, asks questions, why? What is this? Why? When? Also, the child begins to actively say no, I don't have, I won't, I don't want to. From 3 to 4 years old, the child reacts to voices, such as coming from another room, to music, radio and television. He distinguishes between words pronounced correctly and incorrectly, for example, toad, chill. The baby pronounces longer and longer sentences, uses more and more words and asks more and more questions. At the age of 4 to 5 years, a child can carefully listen to a fairy tale and watch a cartoon, and at the same time can answer questions related to their content. During this period, he begins to build complex sentences, although he does not always use grammatical forms correctly, uses more and more adjectives, can tell a simple story or retell a fairy tale. The most intensive period of speech development falls on the first 3 years of life. The ability to speak is crucial for communication between toddlers and for understanding language in early school age. When to consider visiting a speech pathologist. Some speech defects are physiological in nature and disappear over time, more often in 3-year-olds. Others need to be corrected as early as possible so that they do not become permanent and cause problems in the future. Take your child to a speech therapist if A child at the age of 4 months does not respond to sounds and voices from the environment. A chattering or already speaking child begins to regress in speech development, to forget some words, distort them, confuse them. A 1-year-old child does not know how to point to parts of the body, does not make bye-bye gestures, does not establish contact, including visual contact, with parents, crying often and for a long time. A 2-year-old child speaks little or does not speak at all, cannot form a simple sentence. A 3-year-old child speaks very slurredly, does not maintain eye contact with his mother, cannot use simple words, phrases, sentences, cannot focus on one thing. A child of early school age has learning difficulties, speaks little, distorts sounds, lisps, stutters. A communication disorder can have a wide impact on a child's life and persist into adulthood. This disorder can make it difficult to communicate in the classroom, affect a child's academic performance, and lead to social isolation. If you suspect your child has a speech disorder, early contact with a speech therapist is key. What does a speech pathologist recommend? While there are general guidelines for determining if children are developing correctly, including the age at which they start talking, each child learns and improves at their own pace. However, remember that speech disorders detected at an early stage are much easier and faster to correct. If the speech therapist confirms the presence of a speech impediment, the following will be recommended. Speech therapy exercises and speech therapy games aimed at the development of speech and its correction. Additional consultations of doctors, phoniatrist, otolaryngologist, neurologist, orthodontist, if a speech defect is detected or suspected to be caused by malocclusion, defects in the structure of the larynx or oral cavity, poor hearing, genetic defects or mental retardation. What would you like to advise parents? Talk a lot with your child, watch cartoons with him, learn new words to stimulate his speech development. Do not use diminutive forms, do not distort words and do not lisp. The child learns by imitation. As your toddler develops an interest in fairy tales, read age-appropriate books every day. Thank you for watching. Make sure you like the video and subscribe for our new content. Click the bell sign to stay in contact with updates from us. Hope seeing you back on Lify Life.